This is Pet Life Radio. Let's talk pets.
Welcome to ER Vet on Pet Life Radio. I'm your host, Dr. Justine Lee, and I'm an emergency critical care veterinary specialist and toxicologist. Thanks for joining us. Today, we're going to be talking about summertime trauma. And the most common trauma that I see is what I call hit by car, or HBC. We'll be right back after these messages. Hi, Dr. Justine Lee. Do you know what I love? My cat, Lola. What I love about her is whenever I take a nap or go to sleep, she always wants to snuggle right up against me. You know what I don't love? Cleaning up after Lola's litter box, which is why Arm & Hammer created new cloud control litter. There's no clouds of nasties when I scoop. It's 100% dust-free, free of heavy perfumes, and helps reduce airborne dander from scooping. So what happens in the litter box stays in the litter box. New cloud control cat litter by Arm & Hammer. More power to you.
Let's Talk Pets on PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Today, we're going to be talking about HBC, or hit by car. Now, nothing is scarier than seeing your dog or cat undergo the trauma of being hit by a car or finding your pet along the side of a road. We call this hit by car because it's a really common problem that we see during the summer. And oftentimes, I see 1 to 2 hit by car dogs or cats come into the emergency room every single day. This is more common during the spring and the summer because when it's sunny, it's warm out, dogs are running off leash or cats are exploring outside. Now, the severity of injuries that can occur if your pet undergoes trauma like this really depends on how fast the car was going and where on your pet's body they may be hit. Your veterinarian is going to ask some really important questions, such as, did you witness it happen? Did your dog or cat urinate or defecate before they were hit by a car? Did you see your dog or cat get up after they were hit? Did the owner stop? Was your dog off leash? These are all really important questions that let us clue together some information on how severe the trauma is going to be. Now, with hit by car trauma cases, they can range from mild skin scrapes to severe, sudden, acute death. And that's oftentimes, sadly, when a pet is found on the side of the road, and that may be due to severe bleeding and internal trauma. With hit by car situations, the trauma is typically what we veterinary specialists call blunt injury. And that's when stretching or crushing of the tissue can occur. And this can actually be very, very dangerous. What ends up happening when your dog or cat is hit by a car is it can result in both thoracic trauma, in other words, injury to the chest, and abdominal trauma, which is trauma to the abdomen. And that can affect organs such as the liver, the spleen, the kidneys, the bladder, or rarely even the intestines. When it comes to chest injury, the most common type of injury I end up seeing are lung tears. This is called a pneumothorax, and this is a tear in the lung lining. And this results in abnormal leakage of air out of the lung into the chest cavity. If you've ever played hockey before or you watch hockey and you see a hockey player get checked into the boards, very, very rarely they can get a pneumothorax from a lung tear also. Thankfully, a pneumothorax is totally treatable, but it can be expensive to treat. We oftentimes will have to stick a sterile needle into the chest cavity to evacuate that air so your dog or cat can breathe better. If that air keeps on refilling, sometimes we'll have to anesthetize your dog or cat in order to put chest tubes in to evacuate that air. Thankfully, the prognosis is good, but it does require 24/7 care, typically for several days in the ER vet. The second type of thoracic trauma that I can see from being hit by a car are pulmonary contusions. This is a fancy medical way of saying lung bruises. And unfortunately, this can result in difficulty breathing or coughing of blood. Now, most of the time, I always recommend doing x-rays, which I'll talk about later. But this is important because we want to look for internal injuries like the pneumothorax, the tear in the lung lining, or pulmonary contusions, the lung bruises. Now, keep in mind, if you've ever been accidentally punched in the face, you don't get a bruise immediately. You get a bruise 2 to 3 days later. So with pulmonary contusions, we oftentimes will see signs of difficulty breathing, but they might not show up on x-ray until 24 to 48 hours. So this is something your ER veterinarian is going to need to pay special attention to make sure your dog doesn't develop this. Another type of trauma that I can see are fractures. This typically happens if a dog or a cat get hit by a car and their leg gets run over. So we can see fractures of the legs. Sometimes we can see fractures of the back in severe cases. And unfortunately, the majority of fractures do need to be surgically fixed, and this can be really expensive to repair. The next type of injury we oftentimes will see with any type of hit by car are called degloving wounds. And this is when the skin is severely injured after having trauma from the road. This does result in expensive surgery and oftentimes requires daily bandage changes at your veterinarian. Sometimes that needs to be done under sedation, so it's not painful to your dog or cat. I talked before about abdominal trauma. Thankfully, this type is a little bit less common, but sometimes we can see internal bleeding from laceration of the spleen or injury to the liver. With abdominal trauma, sometimes we can see a bladder rupture. This is relatively rare, but with severe trauma, it can actually rupture the bladder or injure the tubes, the ureters, leading from the kidneys to the bladder. This also requires emergency surgery and can be very painful. I will honestly say, as an emergency veterinary specialist, I rarely see bladder rupture from being hit by a car. The rare times I see a bladder rupture are typically with weird accidents. For example, if a dog's trying to jump into the back of a pickup truck and they accidentally fall and hit the back part of their abdomen onto the flatbed part of the truck, sometimes they'll develop a ruptured bladder from that. I've seen it when dogs are dock diving and jump off a dock. They're trying to get into a boat and they accidentally miss the boat or hit the dock, and they can rupture their bladder that way. So just be aware, we want to be able to prevent some of these accidents and also be able to recognize this kind of trauma, because with any type of trauma, the sooner that we recognize it, the sooner that we treat it, the better the prognosis. The last type of rarer abdominal trauma I can see is something called a bile peritonitis. And this happens, but it's super, super rare. In my 20 plus years of being a veterinarian, I've only seen this a handful of times. And this happens when the gallbladder, which is hidden underneath the liver, accidentally undergoes trauma and ruptures. That results in bile leaking into the abdomen. The last type of injury we can see are central nervous system types of injury. That means any kind of injury to the spine or the brain. So underlying head trauma, or even a traumatic ruptured disc in the spine. These types of injuries can potentially result in paralysis. Now, while this list of complications from being hit by a car isn't all inclusive, I wanted to give you a heads up on it because it's a general idea of the severity of the injury that can happen when animals are hit by a car. Let's continue with this really important topic right after these messages from our sponsors.
Does your dog itch, scratch, stink, or shed like crazy? Come to DACVECC for help.
Order a 90-day supply of Dynovite.
Dynovite is nutrition.
Pick up 2 bottles of LicoChops. Get the 3rd bottle free.
New improved LicoChops with omega-3, omega-6, vitamin E.
And now, 6 extra direct-fed microbials.
Even better for the digestive tract and immune system.
Try LicoChops. Buy 2, get 1 free.
At Dynovite.com.
DINOVITE.com.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to ER Vet on Pet Life Radio. Today, we've been talking about the dreaded trauma hit by car that happens a lot more in the animal ER during the spring and summer. That's because, again, dogs and cats are outside running around in the nice weather. So far, we've talked about what type of trauma we can specifically see. Sometimes we can see injury to the chest cavity or the abdominal cavity, to the skin, or even to the central nervous system. Now, I always tell people the safest thing you can do to prevent your dog or cat from being hit by a car is to make sure that your dog is always leashed with you and that you keep your cat indoors. It's also important that you make sure to protect your pets, especially since July 4th is coming. During July 4th, a lot of animals will actually run off, escape out of the house because they're freaked out by the sound, and they accidentally escape and undergo trauma. We'll talk about this in a future episode. Now, I will say unstable hit by car cases that are really shocky oftentimes cost several $1,000s to treat them. And that's because it's going to require life-saving care and typically 24 hours a day for several days. Now, what are some of the signs I can see from trauma? Signs of shock include pale gums, a racing heart rate, a really low blood pressure, the inability to walk, collapse or weakness, difficulty breathing, panting constantly, blue-tinged gums, coughing up blood, not breathing well, having blood come out of the mouth, nose, eyes, or ears, having uneven pupil sizes, not acting appropriate or seeming really dull and quiet, acting really painful, having any wounds to the skin, limping or not being able to walk, or unfortunately, like we talked about before, being found acutely dead. Now, if this happens, you always want to get to your veterinarian or the ER vet immediately. Any trauma patient should always be assessed. And the main reason why is because your veterinarian is going to want to do a thorough physical exam. I always recommend doing x-rays of the chest, abdomen, and pelvis to look for any kind of organ injury or fractures. I oftentimes will do blood work to look for the presence of blood loss or organ injury. And I'll oftentimes do a rapid ultrasound, what I call a fast ultrasound or a level 1 ultrasound. I do this in the ER because I'm trying to look for evidence of internal bleeding or a ruptured bladder. More importantly, how do we treat the hit by car patient? Well, unfortunately, it can be costly because it requires emergency stabilization, placing IV catheters, starting them on IV fluids, treating them with oxygen, putting them on pain medication, giving them blood transfusions if needed, performing life-saving procedures like an ultrasound, a belly tap, or that procedure to pull that abnormal air leaking out of the chest cavity, putting in a chest tube, monitoring their blood pressure and oxygen level, or even what their heart rhythm is doing. Doing major or minor surgery once your dog or cat is stable, whether or not that's cleaning up some wounds, repairing fractures. Again, we usually only do this once your pet is stable. Putting on bandages, or in severe cases, putting your pet on a respirator or ventilator to help breathe for them. I know that all sounds really scary. The most important thing is please be aware trauma such as hit by car is so common during the summer. So what are my veterinary specialty tips for preventing your dog or cat from being hit by a car? Well, some general tips are, again, to always keep your dog on a leash or under strict voice control. If your dog doesn't come immediately back to you 100% of the time when you call it, it's never worth letting your dog off leash unless it's a completely secured, fenced-in area. The second tip for prevention of trauma is make sure to teach your dog the leave it command. I'm a firm believer that every single dog, regardless of age, should go through 2 semesters of puppy obedience because there are certain commands that are imperative for your dog to know. This is especially important because it can be life-saving. When in doubt, make sure you take your dog to that obedience class because they need to learn the life-saving command, leave it. When your dog is in the middle of chasing a squirrel, a firm leave it may save your dog's life if they stop chasing that dog. The third way of preventing a hit by car is making sure you supervise your dog at all times. I have a fenced-in backyard, but I'm always home when I leave my dog outside. I'm always worried that unsupervised dogs in a yard can hop the fence or dig out from underneath, or in rare cases that someone's going to open the gate and let my dog out. The next way we can prevent any kind of trauma is make sure that we always have a firm grasp on our dog or our cat when somebody opens the door. We'll talk about this again in a future July 4th episode, but if you're letting the pizza delivery guy in, you want to make sure your dog and cat are locked in another room so they can't escape outside. My next tip, please don't let your dog chase cars. Some dogs are so prey-driven, they're going to run after anything that takes off. So they run after the biker, they run after a jogger, they run after cars. This is really, really dangerous. And you want to work with an animal behaviorist or a dog trainer to make sure that this isn't happening. If you have a cat, please make sure to keep them indoors. If you want to let your cat outside, please make sure to supervise them on a leash or in a fenced-in yard so they can't escape or jump. My next clue is be careful with those retractable leashes. Even the well-intentioned owner may lose control because those retractable leashes allow your dog to be on a really long leash, and you may not be able to reel your dog back in time. I've seen dogs accidentally hit by a car when they step off the curb and they run into the street, even though these leashes are on. And the last way you want to make sure to prevent a hit by a car is to make sure you know where your dog or cat are in the driveway. One of the worst types of trauma that I see is when pet owners accidentally run over their own dog in the driveway. They're backing out the car. They didn't realize their dog or cat was sunbathing in the driveway. And this slow roll trauma, in other words, it's a very low velocity crush, results in more severe internal damage. When in doubt, please make sure to help minimize the risk of your dog or cat being hit by a car. And please make sure to keep them safe. Well, that brings us to the end of today's show. Find me at drjustinelee.com, on Facebook at Dr. Justine Lee, or email me your pet questions at drjustine@petliferadio.com. With that, we're out of time, and we want to thank Mark Winter, our producer, for making this show possible. See you at the next episode.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.